I'm Elise Horst, Director of AI Solutions here at Fathom. We wanted to take a moment to record the presentation that we shared recently at HCIC in Austin, Texas. For anyone who may have missed the session or wasn't able to catch it, we presented a lot of great AI use cases that are all through the marketing funnel in partnership with our friend Liz over at Penn Medicine. So these are a few use cases that we hope you can take and implement into your marketing efforts today. We've seen a lot of success in using them with Penn Medicine and continue to experiment with them in terms of the ways that we use AI to support their marketing efforts, but wanted to take a few minutes today to share those with you all. So we're going to talk about these AI use cases throughout the full spectrum of the campaign lifecycle. So we'll start all the way from the planning phase, where we're using AI to support things around budget decisions. And that's really important because AI helps us comb through a vast amount of data and information in order to add precision to our marketing efforts, and that enhances the patient journey immensely. And then once a campaign is live, we'll move into some examples of how we can use AI to help optimize performance. So there's a ton of optimization opportunities available to us all the time as digital marketers. A lot of AI is already baked into the platforms that we use on a day-to-day basis. And we're going to share a couple examples of how you can supercharge those efforts with AI in order to get more out of your campaigns once they're live. And then last but not least, we'll talk a little bit about how we use AI to help measure performance. With Penn Medicine, we run a vast number of campaigns, and reporting on them can be really time consuming. So, AI is a great way for us to maintain command across several different programs and a ton of different metrics in order to hone in on what matters most, what we need to optimize, and what we should be bringing to our clients and clinical partners in terms of what matters most about performance. So, let's dive into the first bucket, which is planning. And again, planning is really more than just having a good campaign brief, right? It's about budgeting media spend more effectively. We all have a finite number of dollars available to us. We know that marketers have been really challenged by shrinking budgets, especially in the healthcare space. And we need to make sure that we're being good stewards of that budget and that we're using them to maximize potential so that we can meet our healthcare organization's goals that are increasing, even though our budgets might be shrinking. So, planning and AI together help us budget media spend more effectively. And let's talk about a couple of ways that we do that. The first is using AI to help support flighting. So, flighting is something that is typically more reserved for traditional media tactics, but it comes into play with digital as well, especially with things like seasonal demand that we know exists for several service lines. Orthopedics, bariatrics, primary care, they all have distinct seasonal ebbs and flows where there's more demand or maybe a little bit less. So, spending your dollars in alignment with those seasonal variations can really help you make the most of performance. If you're spending all your budget at a time period when demand is naturally slow, you're not going to get the most out of those dollars versus if you really pump those into time periods where there's a lot of demand and interest in your service line or area of expertise. And flighting can be a bit subjective. It's a lot of, we've done this in the past, we kind of know this vaguely about the service line. So AI is a great way for us to put some data-backed research behind our recommendations and make sure that we're flighting things and distributing dollars in a way that actually makes sense based on data. And Penn Medicine is really fortunate to have a wealth of data at their disposal. So they already have a lot of great insight into what seasonality makes the most sense for their service lines. And they share that with us a lot of times. So, what AI can help us do in those instances is help layer on some additional context. So, we have the data around when leads spike and when they kind of dial back. And we can use AI to provide a bit more context around why that is and help us get a little bit more information out of that data. So for this particular example, we use an AI tool called Perplexity, which many of you have probably heard of. It is a free AI search engine, and it displays a lot of the information that you would typically get by clicking into link after link in the search results. So instead of having to do that and navigate through a ton of different websites to find the information that you were actually looking for, you can give Perplexity a bit of a longer prompt with a bit more context, and it will return to you sort of like a research essay with results based on what you asked it for. The other key takeaway for Perplexity is that it cites its sources. So you don't have to be left wondering around if the information AI is giving you is accurate or not. You can actually see where it's getting its information and make a judgment call as to if you trust that source or not. Or you can even do a little bit of additional research, click into that source, make sure it seems like something that aligns with what you're looking for or is valid and credible. So it's great from that perspective because it cuts a lot of time out both in fact checking and in actually navigating to do the research. So in this case, we used sports medicine as an example. So we asked, what are the peak times of year for sports-related injuries that require orthopedic care? Perplexity did some research in a matter of seconds and returned some insight around how spring and fall are peak times for sports injuries. Those are key sports seasons, especially for younger ages. And it gave us some context around what types of injuries might be included in the sports that they're associated with. So this really helped provide context to data we had, which was simply when are we seeing ebbs and flows in click-through rates or inquiry rates or lead volumes, and helped paint a bigger picture around why some of those things are. And what that allowed us to do is come back to Penn Medicine with not only a media plan with our forecasts and performance estimates for the full campaign for sports medicine, but also some strategic direction around when they should focus those dollars. So we planned for a spring flight, we planned to dial back a bit over the summer months, and then heavy up again in the fall. And what you can also do is start to layer in some creative direction. Sports medicine is a really great example for this, where because of our research, we understand which sports are taking place in the spring and the fall, and so the injuries that are associated with them. That's a great way to add a layer of personalization to your ads so that they feel really relevant and timely to the audience who's looking for that information at that time and helps improve patient engagement even more. So once you have an idea of when you need to spend your dollars, the next question that we often need to answer is how much should we spend? And at Fathom, our media planning process is really rooted in the audience size. The reason for that is that audience size is a great indicator of how much budget to spend. If you need to reach 2 million people, your budget's going to look a lot different than if you only need to reach 200,000 people. So having an idea of the size of the audience that you're reaching is really important to budget effectively. You don't want to budget too much and inundate the audience and have a really high frequency. And you also don't want to budget too little and make your performance ineffective and not quite meet expectations. And as marketers, we've really been kind of forced to use our ad platforms as our source of truth for audience size. So this is an example from Meta. Meta is probably one of the biggest culprits in terms of overestimating audience size or giving you an answer that doesn't quite feel accurate. I'm sure we've all been there where you've gone and you've estimated an audience size and it's returned a size that just doesn't even make sense in the context of the population of the geography that you're working in. And that happens to us a lot, and it really impacts our ability to make meaningful and accurate budget recommendations that support our clients' goals. So, what we did, and you can see here, we just generated an estimate for you so that you can see what that kind of looks like. And you can see the disclaimer here in the bottom that says that estimates may vary over time. They should not be interpreted as the number of accounts and accounts who are actually viewing your ads. So Meta is telling you that it's not the best way for you to get this information. And yet, as marketers, we're really limited. We don't really have a ton of options that are out of the box for us today to get more reliable audience size estimates. But there are really great data sources around audience size. So I'm sure you're familiar with the United States Census Bureau, Pew Research Center. These sources give you really reliable and robust data about the populations of different areas, how they consume media, and what have you. The problem is just that the data sets are really robust and they're hard to access and manipulate in a way that we can do so frequently for all of the campaigns that Penn Medicine is planning on a regular basis. So what we did is we ingested those data sets into a tool called Akkio. And Akkio is an AI-powered data analysis tool. It's basically like having a whole BI team in your back pocket. It's one of our favorite tools that have AI and data capabilities together. It's privacy safe. It allows us to do really amazing things with data that we weren't able to do before manually. So, one of those things is uploading a huge data set like the US Census Bureau. We ingested zip code level data about the population, so we know how many people fall into each age range, each gender, what have you, at a zip code level. And then what we can do is we can go in and query that data set using Akkio's Chat Explore functionality. So we can ask Akkio for an estimated audience size for a specific list of zip codes within an age range and a gender, and it returns an estimated population size for us. So in this example for orthopedics, we got an audience size estimate of just under 2 million people. And then we can take that a little bit further. So what we'll also do is take that Pew Research Center data. We have that documented internally, so it's standardized. And that gives us insight into how many people use each different platform. So what we can do then is look at, okay, if we're planning for Meta, we can understand what percent of the population in those age ranges typically uses Meta. And then we can layer that percentage on top of the total population so that we can get specific audience size estimates for each platform. And that really enhances the precision in which we're able to budget for our media plans. And the two of those things come together. So your flighting recommendation, your budget recommendation based on your audience size, those really are what marry together to form your media plan. So now you know when to spend, you know how much to spend, and you can distribute those two things over the course of the year or your flight in order to make a really informed approach to how much you should be budgeting to reach your goals. And this is something that we do on a regular basis with Penn Medicine. Every time we plan a campaign for them, we're going through and thinking about flighting as well as audience size, and we're using AI to help us increase the precision and accuracy with which we do those things. The next bucket that we're going to talk about is activation and optimization. So you've planned your campaign, you've used AI to make sure that you've budgeted appropriately. Now, what do you do once it's launched to make sure that performance meets your expectations, that you're doing everything you can to get the most out of your campaign? AI can help with that. There are lots of ways actually that AI can help you maximize your outcomes when, again, resources are limited. We aren't able to dedicate hours upon hours and whole teams of people to making optimizations, but they're necessary and we need to make sure that we're doing them often in order to help improve performance. So for Penn Medicine, one of the main ways that we're using AI to optimize is when it comes to ad copy for paid search. The reason being that Penn Medicine is running a large volume of paid search campaigns. At any given time, we have 80 plus campaigns in market across a variety of service lines and locations. And when you think about the fact that each of those campaigns contains multiple ad groups, each ad group contains multiple ads with headlines and descriptions that combine to make a responsive search ad, that's almost 5,000 different opportunities for optimization when it comes to just ad copy alone, not even the rest of the things that we can optimize within a campaign. So you can see how this starts to add up and take a lot of time to optimize these different pieces of the campaign that are important, but are a bit tedious when it comes to time management and making sure that we're optimizing ad copy effectively. So for this example, with generating paid search ad copy, we used a couple of different AI tools. We used Akkio, which is our data analysis tool. We also used ChatGPT, and this really allowed us to supercharge our ad copy generation process in a way that added a ton more value and clarity to the process without adding an astronomical amount of time to it. So we were able to go from a process that we've used in the past. It works pretty well. We look at the landing page, we analyze the copy on the page, we understand how our client, in this case, Penn Medicine, is talking about their service line, proton therapy, and we use that to inform ad copy. And that's not bad by any means. You want your ad copy to align with the copy on your landing page. That's one of the core tenets of Google's ad rank. So making sure that those two things align is really important. And that said, it also leaves a lot to be desired in terms of additional context and information that you can use to make sure that your ad copy stands out and addresses patient needs. So imagine being able to do all of these things now that are on the right, in addition to just looking at the landing page and making your ad copy sound cohesive. So we were able to use AI to help us generate an audience persona. So for this, we were able to understand the mindset of someone who might be interested in proton therapy to help us really understand what it is they're looking for, what would compel someone to take action, what are the things that they're looking to hear from a healthcare organization as they are making the decision as to where to receive proton therapy treatment or decide if it's right for them. We also were able to do some historic ad performance analysis. So for this, we looked at 4 years worth of data for the proton therapy campaigns that we'd been running for Penn Medicine. And we were able to understand which combinations of headlines and descriptions have yielded the highest engagement in the past so that we could learn from those things and understand what stands out, what isn't resonating, and we can bake that into our revised ad copy. We were also able to do some competitor messaging analysis. This one in particular can be really time consuming, right? It takes a lot of time to go in and export competitor ads from a tool like Ahrefs or SEMrush. It takes even more time to comb through all of that and find actionable insight. So using a tool like Akkio is a great way to make sure that you can review all of that data at scale and also derive some meaningful insight that you can then apply to what you're doing here. So that's message theme identification, which in this case we did through Akkio, but you can also use ChatGPT. That's another really good tool for theming up your analysis and helping you get some good insight from it. So what do some of those outputs look like? Here's an example. I mentioned analyzing competitor ad copy. So in this case, we uploaded that ad copy to Akkio. We were able to use, again, the Chat Explore functionality to understand and engage with that data set. So in this case, it generated a little visual for us to recap what we were seeing in terms of the most common words used in the copy. And what we saw is that, for example, Penn's most engaging ads looking at performance featured the words treatment over just talking about cancer or therapy. But competitor messaging was not really treatment focused. They were focusing mostly on proton or cancer, which makes sense. But that helped us find a place where we were already standing out and seeing some success. And so we were able to take that insight and build upon it in the copy that we generated. And not surprisingly, when you go through all of the effort to make your ad copy stand out and really address the audience's needs and their mindset, you see better results. So, in doing that, we saw an 11% lift in click through rate pretty immediately when we launched the new ad copy. And we've seen that continue over time. We did this maybe 6 months ago at this point, and we've seen click through rate remain at a higher level. And that's really important, not just because you want to have a good click through rate, but because something like proton therapy is extremely important to Penn Medicine. It's one of their flagship service lines, and making sure that we can drive strong engagement and get patients the information they need so that they can choose to get proton therapy at Penn Medicine is huge, not only from an ad engagement perspective, but from a supporting the patient journey perspective as well. And if you take a minute here on the screen to kind of read through the ad copy, you can at a glance see the difference in terms of the way that we were talking about proton before and the way that we were talking about proton after, once we got a deeper understanding and a more robust picture of what the full context of that patient journey looks like. An ad copy is just one way that you can optimize performance in your campaign, and it's certainly just one way that you can use AI to do so. Another great optimization opportunity, following that theme of precision and really dialing into what makes the biggest impact for patients, comes analyzing search terms. So, this is a really tedious process, again, related to paid search, where there's just an immense volume of data available to you. And it's really time consuming to go through this process on a regular basis for all the campaigns that you're running. But again, it's really important. So, analyzing search terms is what allows you to see all of the different queries a person is making that ultimately trigger the keywords that you're bidding on. So, it gives you a sense of just how effective your keyword strategy and your match types are at finding the right traffic that's relevant to you. So, when analyzing your search term reports, often you'll find things that are a little bit irrelevant, maybe are related to what you're doing, but aren't quite at the right level of intent. And that allows you to negate those things and ultimately make better use of your dollars because you're no longer spending them on terms that aren't relevant to your goal. And you're focusing most on those people who you really want to nurture through the funnel. So this is a great example of a way that you can use ChatGPT. You could use a variety of other AI tools and LLMs for this. In this case, we use ChatGPT. We have ChatGPT teams here at Fathom, so we're able to upload data in a really secure way. And so that's why we use chat for this. But you're welcome to upload your data into any other privacy safe tools as long as you have those security protocols in place. So, for example, what we did in this case, this is a primary care example. We pulled the search terms report. I believe I pulled the last 30 days or so. You can pull whatever time frame makes the most sense for you. And I liked to prompt with just enough clarity to tell AI what I want to do, but I'm not trying to tell it how to do it. And that's really key because I find that a lot of times people can put a lot of detail in the prompt and they're ultimately just kind of limiting AI's creativity. AI is super smart and knows a ton of different ways to do things. It might take different steps to get to the outcome that you're looking for than you intended, but it's meant to do that. So I like to give it a bit of context. In this case, I told it this is a primary care campaign for Penn Medicine. My goal is to get people to make primary care appointments. I gave it some context around the data I was providing. These are search terms that trigger our search queries, what have you. And then I gave it the ask. I, in this case, wanted it to group things for me. So I wanted it to group things into three buckets: things that it felt were wasteful, things that it felt were irrelevant, and things that may be related to primary care, but just are too upper funnel. They don't align with my goal of getting people to actually make appointments. So from that initial prompt, chat did a pretty nice job of returning summarized view to me in those groupings that I asked it for. I did feel like it could be a little bit stronger. So one of the nice things about AI is that you can go back and ask it to redo things as many times as you want, and it's not going to get mad at you like your coworkers who wish you would have given them more instruction the first time. AI actually works better this way when you break things down into smaller tasks. So in this case, I felt it could be a little bit better. So what I did was I gave it the landing page copy. At this point in time, you can actually have chat reference a link. So you could just give it the link to the landing page. Before I was print PDFing things as kind of a hack to get around it not being able to crawl websites. So that's what I had done in this case. I had print PDF the landing page copy, sent it to chat, and asked it to redo the exercise, having that additional context around what we were asking people to do on that page. And that helped chat really understand better what's relevant and what's not now that it had that additional context. And then lastly, one of my favorite ways to use AI is to have it do the work and then have it summarize what it did, because an important step is making sure that you review AI's work and understand its outputs and make sure that those align with how you would have approached things and got to accurate recommendations. And so having it summarize its work is a great first step in QAing what it did. So in this case, I had it theme up the things that it recommended negating, and then it gave me some examples of those things. So I could quickly look through this and kind of understand if it was on or off point. And then I could dig in more depth if there was something that I'm like, well, maybe I want to negate some doctor names, but not all. At least I know now that that's kind of the approach that it took. So I can go back and look for that in more depth. Another thing that you can and honestly should do at this point is give chat some feedback. So if you're looking at this and you're saying, you know what, some of those location specific terms are actually really important to this campaign, let chat know that. So when you go in the future and you do your search term report next month, that it can learn from that and take that into account, and you won't have to give it that feedback next time. And then another way that you can use AI at this point is get your list of negatives together based on its recommendations after you've QA'd it. Have chat act as a QA partner too. So give that list back to chat and ask it to make sure that it aligns with its recommendations and that you didn't miss anything. That's a great way for you to get another set of eyes on your work to make sure that it is complete and accurate, and also a great way for you to change to do things to your level of standards as well. So those were a couple of ways that you can use AI to optimize performance. Last but not least, I want to cover a few ways that we use AI to support with measurement. So once we get a campaign up and active, we are constantly monitoring performance. And then on a monthly basis with Penn Medicine, we're having some reporting conversations with them. And so this workflow really helps us expedite the way that we're able to get to actionable insights. And it also facilitates a more collaborative conversation with the client around performance and making sure that we're delivering visibility into how things are performing faster and more effectively than we were able to do before. So when it comes to performance, Akkio again is our favorite tool. So that's the one that we're using here. So like I mentioned, we really integrated AI into our monthly reporting process with Penn Medicine. I mentioned earlier, Penn Med runs a ton of different campaigns for a variety of service lines, and our team loves to use AI to sort through what happened in terms of performance across all of our campaigns and understand what that performance was caused by and also identify optimization opportunities and then bring that to our client, in this case, Penn Medicine, to help have a conversation around performance and what we should be doing differently. So using Akkio is a great way to do that. Again, you can upload the data safely and securely, and then you can do a few different things with it. So we're going to talk a little bit about the ways that we use Chat Explorer, which is again a way for you to engage with your data and derive insight from it. And then we'll also talk a little bit about the reports functionality. Some other things that we won't cover today, but that are capabilities, are for you to forecast and predict outcomes. So if you're looking to understand what might happen in the future, Akkio also has some great capabilities in that regard that you can leverage also using the data sets that you're uploading to Akkio. A few different prompts that you might try if you use Akkio to help with any kind of reporting or measurement work that you're doing. You might have it identify some key changes. So when you're managing a large volume of campaigns, sometimes that's half the battle, is just having something help you flag when things were significantly up or down month over month. So we can pick out key service lines and programs that had notable shifts in metrics that we're monitoring, like spend and clicks and conversions. And again, there's a difference between looking at things on an ongoing basis, which we are, and then really taking the time to digest and look back at the last month and understand how things have been trending. So this is a great way to identify some of those outliers and then make sure you're addressing those things in your optimizations. Another prompt you might try is just looking at any programs or service lines where there was a significant change in spend and doing some analysis to understand if that change in spend impacted performance in the way that you expected it to. So a lot of times with Penn Medicine, we'll notice that there's additional opportunity to spend to help them get closer to their goal. And so we want to go back and make sure that we're evaluating if those dollars actually move the needle in the way that we thought they would. And using Akkio is a great way to do that because it can really support in some more advanced analysis around what metrics changed in correlation with that spend increase, if that was significant or not, and really give us the data to understand and validate some of those budget decisions that we're making. Another opportunity is to identify trends. So we talked about identifying outliers, but another great thing to do on a regular basis is also make sure that you're understanding kind of the larger context of performance. So we love to use Akkio to identify service lines that have shown consistent increases or consistent decreases over specific months so that we can understand, okay, has something been declining for quite some time? Is something really taking off that we should be aware of? Are these patterns in line with seasonal demand? And we should start to think about budgeting differently and flighting. So a lot of great ways for us to use Akkio to understand the bigger picture without necessarily having like a dashboard in front of us. And then lastly, it's great for ad hoc analysis. So a lot of times we'll use it to analyze changes in, for example, click-through rate, understand where we saw those changes, when and why. Akkio is great at providing some additional context and also just doing quick calculations over a large data set so that you don't have to manipulate things in Excel, create pivot tables, what have you. And then a really nice thing about Akkio is as you're doing all that, it's generating different visuals for you. So sometimes it'll give you a text answer if it's a really simple question, but most of the time what it's going to return is some kind of table or visual that helps you add a bit more context to the ask that you gave it. So in this case, we were using Akkio to facilitate some year-end reporting, which we actually shared with Penn Medicine in the format of an Akkio report. So that was a really cool experience to deliver something to Penn with AI forward. And it was really great that we were able to embrace the technology in that way. In this case, we were creating some visuals around where spend increased or decreased in clicks. So this did a really nice job of just summarizing that for us in a table format. You can also prompt it and ask it to visualize things in different ways. So in this case, we use some bar graphs. And then again, the functionality at the end, you can copy a secure link and you can share that internally with your team so that you're all working off of the same information when you're talking about performance. Or you can share it, in our case, externally, like we did with Penn Medicine, so that they're able to view the work that we did in Akkio. And it saves us the step of going and putting something in a deck so that we can instead spend that time really collaborating with Penn Medicine and understanding the impact of the performance that we're seeing as it relates to patients and the health system's goals. So those are a lot of examples of ways that you can use AI throughout the marketing journey, all the way from campaign planning to measurement. So some key takeaways for you now that we've gone through a variety of use cases that you can take back and implement into your work. Use AI to find efficiencies and create value. Explore both of those. I think a lot of people kind of stop at using AI to cut time out of tasks. And while we've definitely done that and we've created a lot of efficiencies and some repetitive work that once took a lot of time is now supported through AI in a lot of our processes, we're also using it to create value and to add more complexity and context to the work that we're doing for our clients so that we can deliver a better result. Think about tapping partners to speed up AI adoption. So at Fathom, we have our own internal vetting process to make sure that all of the tools that we use are safe and secure and reliable. And we're able to do that a bit more nimbly than a huge healthcare organization can do. So make sure you're tapping your partners not only to use AI and to adopt it, but also to test out which platforms you like and which ones you don't. So that way you know which ones to go to bat for and make a use case for internally to go through your more robust vetting process that may be a bit more time consuming than the process that we employ at Fathom to make sure that everything's safe and secure. And then last but not least, consider starting with the use cases we shared. So we talked about a few use cases as it relates to planning and budgeting media spend more effectively. We talked about developing richer ad copy and using AI to comb through the large data set that is a search term report. And we talked about using AI to deliver better performance visibility faster with something like Akkio that is built to ingest your data and give you ways to activate on it. So hopefully these are some helpful takeaways and some use cases that you can implement into your marketing efforts, all in the interest of improving patient engagement and using AI to help you along the way.